Welcome. If you or a loved one is experiencing pain anywhere in the body, particularly in the joints, this video is definitely for you. We're going to be talking about ice massage, cryotherapy. There are 5 things that this will do for your body. So when would you use ice? After an injury, the first 24 to 36 hours to reduce that inflammation. Ice does wonderful things, but ice massage is totally a separate entity than putting an ice pack on you. Because ice will reduce inflammation, it will get rid of pain, it will give you pain relief, it helps numb those nerve endings, give you that joint relief, which I'm going to show you. But the ice massage, as if I had a tennis elbow or I had a knee condition, the ice massage, as we just rub it over the area like this, it's cold. And it gets colder extremely fast, much faster than any type of ice pack. But when you do this, you're obviously going to have some dripping. You could do it over a sink, over a towel, or anywhere else that is convenient for you, but just a couple minutes. You see, when you put an ice pack on there, the ice pack you generally leave on 10-15 minutes, but ice massage gets so cold, and most important, as you do this, you want to move it around because you don't want to burn your skin. Just 3 to 5 minutes of ice massage could do wonderful things. So if it was my knee area and I'm having problems, let's say along the adductors, or I have a meniscus problem, maybe I hurt the meniscus, the cartilage, you'll take the ice, you'll just rub it in circular motions all around that area. Just 3 to 5 minutes. It will get cold, it will get numb, but it penetrates. It penetrates so deeply. It really makes a tremendous difference. If it's your knee, your ankle, your hip, your back, your neck, your elbow, your shoulders, any joint. So let me explain the importance of these 5 particular things that ice massage will do for you. Pain relief, numbs those nerve endings, gives you joint relief. So if you're having pain, better than any drug is ice massage, because it will actually give you that relief of numbing those nerve endings. 2, inflammation. It constricts the blood vessels and takes away swelling. It's an anti-inflammatory. So whenever we have an injury to any particular part of our body, the body produces inflammation. We want to get and limit that inflammation as soon as possible, right away, so the healing will be expedited. Number 3, muscle relaxation. This relaxes the muscles around the joint. This takes away the muscle spasm and the muscle tension. So when we hurt the joint, the elbow, the shoulder, the hip, the knee, the muscles will compensate. A lot of times you get muscle splinting because there's an injury. The body's trying to protect itself. So those muscles start to get tight and contracted. And if you want to ease that muscle spasm, take away that pain, by using ice massage, you will definitely see a tremendous change. Number 4 is improved circulation. It's called the rebound effect. The rebound effect means that when we use ice massage in an area on the body, the blood vessels constrict. And when it constricts, it limits the blood supply, limits the swelling, and reduces inflammation. But here's the exciting part. When we finish our ice massage, and those vessels start to open up again because they're not being constricted, as it cools off the skin, those blood vessels, they start to dilate, starting to bring in more circulation. So as we reduce the inflammation, to get rid of the exudates, the toxins, to help the lymphatic system, the blood vessels will eventually open up again to bring more blood supply so we can get more nutrition and quicker healing. The 5th thing is faster recovery. As we reduce that inflammation, as we reduce the exudates, as we help excel that lymphatic system, as we're taking away pain, we are actually improving our recovery, because when you have excess inflammation in a joint, it will limit your ability of the healing, because too much inflammation will cause joint restriction. We can start developing fibrotic tissue, scar tissue. when there's an injury, depending upon how bad it is, if it's mild, moderate, or severe, we want to try to regain that mobility, because if you have a chronic condition, let's say a shoulder capsulitis, adhesive capsulitis, a frozen shoulder, and you don't mobilize it, it will start to freeze, just like a joint. So we want to regain the proper therapy. So ice massage is the best initially to use after an injury up to first 36 hours. If you have a chronic condition and you start developing inflammation, ice massage anytime. You can never hurt yourself. Generally, you're going to use heat, preferably moist heat, after the first 36 to 48 hours. Whenever we do heat, we don't like to put on it more than 20 minutes at a time, but ice massage, 3 to 5 minutes. It's amazing when it comes to problems in the hands, carpal tunnel syndrome, lateral epicondylitis, tennis elbow, golfer's elbow inside, hip adhesions, bursitis. I had a condition right along the medial part of my knee, right down in here, called pes-anserine bursitis. This thing just beat the heck out of me for a few months. And I started doing the ice massage right below the knee, and I started to decrease that inflammation in the bursa. So bursas are present, those little sac-like structures in our shoulders, in our knees, and our hips. You might have heard bursitis, hip bursitis, knee bursitis, shoulder bursitis, extremely painful. Guess what? There's nothing like cryotherapy ice massage. Use the cryotherapy. It will do wonderful things for you, I promise you. You don't have to be on those heavy drugs, those anti-inflammatories, the ibuprofen, naproxen, that has side effects. Acetaminophen, which is not an anti-inflammatory, but a pain reliever. We can prevent liver problems and kidney problems, keep your system nice and healthy by using cryotherapy. This should be one of the most important videos when it comes to helping you with pain and reducing inflammation, the old ice massage. So, I really hope this video makes tremendous changes for you, your family, your loved one, your kids. I promise you, it will definitely help you tremendously as well as them. Please share this video with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandell.